And I think many of you may already know Rachel. She is just a fabulous helper for me. I don't think I could practice medicine without her, an incredible, important part of the tool, of our toolkit. And so she's got the floor for the next half hour to review for you her takes on nutrition and the impact on cancer outcomes. So Rachel, welcome, good morning, and the floor is yours.
Good morning, and thank you for that introduction. I'm happy to be here, and I'm going to go ahead and share my screen here. So I have a few slides that I wanted to share with everybody, and then at the end, I will plan on taking some time to answer some questions as well. So again, my name is Rachel. I am the dietitian that works at the Lombardi Cancer Center at the MedStar Georgetown University Hospital. And today I'm going to be talking a little bit about the general overview for better optimized nutrition during cancer therapy, and then just talking a little bit more about different vitamins and minerals and supplements as it pertains to the cancer journey, and a little bit on how certain nutrients can improve immune health, especially now in the times of coronavirus. So let's get started. Let's see if we can move this slide here. So the goals of good nutrition. Having good nutrition can really proactively help manage treatment-related side effects. It can help preserve body nutrition stores and prevent weight loss. And this is especially important to help preserve muscle loss. Consuming adequate macro and micronutrients are needed to help optimize nutrition status, macronutrients being carbs, proteins, and fats, and micronutrients being specific vitamins and minerals in the diet. Good nutrition can help reduce the risk of cancer reoccurrence and secondary primary cancers and chronic diseases. But most importantly, having optimal nutrition can help maximize the quality of life. And patients with involuntary weight loss was found to receive less therapy and had shorter overall survivals, decreased quality of life, and decreased performance status. But for those who are able to stop the weight loss, they found improved overall survival. So it's also important to understand that those with cancer can experience certain related conditions that affect their nutrition, including decreased appetite, increased metabolic requirements. So I often find that my patients will ask me, oh, I'm eating like I normally am and eating the same amount, but I'm losing weight. Why is that? And oftentimes it doesn't come to first thought, but it can occur that your body is burning more calories. So that's something that you can work with your dietitian on, so that way you can prevent further weight loss. Certain types of cancers can also impair your digestion, absorption, and utilization of food. For example, if you have gastric cancer, some people require surgeries that remove their stomachs and therefore can limit the amount of foods they can consume. And another example is for those who have pancreatic cancer. Some people experience pancreatic insufficiency, where the body isn't able to absorb certain nutrients like fats in their diet as well, and require certain types of enzymes to take with their meals. This is something you can certainly discuss with your dietitian or doctor. Fluctuations in body weight, eating difficulties, and fatigue are most often temporary and resolve during the recovery period from treatment. Okay, and here's some guides and some information on how you can modify your diet to help prevent involuntary weight loss. Following a high calorie and high protein diet is primary on the list, because if you're able to consume enough calories, you can really truly limit the amount of weight loss that you experience. But even more important is the amount of protein in your diet. Protein are foods such as fish and chicken, nut butters, nuts, if you can tolerate them, eggs, and dairy like yogurt and cheese. Also legumes like beans and chickpeas and any other kind of lentils will also have protein. So those are some foods to kind of consider. It's also helpful to adjust your meal and snack frequency. That means that if you are one just to eat 3 meals a day and you're finding that your appetite has decreased, you can start thinking about adding some snacks into your day. So let's say eating 4 or 5 times a day versus 3 larger meals. And by doing that, you allow your body to digest a little bit at a time, and which can help minimize certain side effects like indigestion, nausea, and even for some who have diarrhea, this strategy can help. When eating these smaller frequent meals, you want to make sure to choose nutrient dense foods. And what that means is to choose foods that have a good amount of calories and protein. So for example, eating a peanut butter and jelly sandwich will have more calories and protein than having a salad for lunch. Because while greens are certainly important, I would recommend having a side salad and having maybe a half sandwich with that instead of just the salad, because you'll be able to get yourself a little bit more protein and additional calories that your body requires. Note that specific requirements will vary between individuals. As I mentioned earlier, those with specific disease conditions will have impaired digestion. So talking with your dietitian can help you identify what you need and help you set individual goals. If you haven't had an opportunity to meet with a dietitian, you can start on your own by setting certain goals. And what I mean by that is, for example, thinking about how you are able to hydrate, for example. If your doctor always tells you or is encouraging you to drink 8 glasses of water, but for you, that is an extremely far reach, think about, okay, how many glasses of water am I currently drinking? Okay, 3. So can I try to make a goal for myself to drink 2 more glasses, so 5 glasses, and that's better than the 3 that you're having. And eventually, once you get comfortable with having 5 glasses of water, you can slowly increase to the 8. So setting realistic goals can help you get to the right place in the long term. Planning and preparation is important. I always talk with my patients about this because oftentimes your visits to the doctor, if they are in person or if you have to go in for treatment, they're tiring. They're long days. So thinking ahead in terms of what you want to bring with you to your treatment visits, so that way you have enough food and you have enough fluids, can help quite a bit. Oftentimes I find that my patients who aren't able to prepare and bring foods, they may not end up eating until they return home, and that may be in the afternoon, and you've gone the whole day without eating or drinking. So these kinds of things can really help. Also, for those who live alone, for example, and are responsible for doing all their groceries and cooking, thinking about like when you will feel the strongest and trying to prepare some meals ahead of time to store in the freezer or refrigerator, so that way on the days that you are particularly fatigued, you will have them on hand, foods available more quickly, and you will have less time preparing. Also, just be in touch with family members and friends to make sure that they are able to help you out if you aren't feeling well. And that's just another way to plan and prepare in advance. And then my next bunch of slides, I want to talk a little bit about supplements. And this is because certain supplements can help with improving nutrition. And what I mean is that there are different categories of supplements. The big one I want to talk about is calorie and protein enhancers, and not the vitamins and minerals and herbs. I'll get to that in a moment. So there are certain calorie and protein enhancers, such as protein powders. You can get them from the regular grocery store, or you can get them from specialty shops like the Vitamin Shop or GNC. The most common powders are whey, but you can find them also as casein, soy. Even for vegans, like you can find pea-based powders and rice-based powders, for example. Those are also effective. They can be added into making smoothies to help supplement your diet. I generally don't advise my patients to have these shakes just as a meal replacement, but rather as part of those small frequent meals, to have your breakfast, lunch, and dinner, and maybe in between, if you're not having like a food-based snack, to have the smoothie then. Oftentimes these shakes can be pretty filling, and so they may take away from your ability to eat solid foods if you just drink the shake. And so the other point that I wanted to add here is that you can also buy protein powders that are unflavored. While many do come in like chocolate and vanilla and strawberry, the unflavored protein powders can be useful in situations where maybe your taste preferences have changed and you're not really as inclined to have a strawberry shake or a vanilla shake, but let's say you're able to tolerate some butternut squash soup. You can add a little bit of unflavored protein powder to those soups because the butternut squash itself is low in protein. It doesn't have any additional protein to it, so that's the way to add it. One note about this is that you should avoid boiling and cooking the protein powders as it will denature the proteins, but you can add them after you've prepared the meal just before you're about to eat as a way to use it. There are also ready-to-drink shakes. I just listed some examples here. There's Inshore, Boost, Orgain is an organic shake, Carnation Instant Breakfast, Muscle Milk, and Premier. Just a note about these, they are often very dense in calories and proteins. And for some individuals who, for example, had stomach surgery and had most of their stomach removed, they may not be able to tolerate certain shakes. So you would want to speak with your dietitian about which is best for you in terms of incorporating them. And then let's move on to the next section that I want to just focus a little bit more on. This is new compared to what I've talked about in the past, but I am asked a lot about vitamins, minerals, and herbal supplements. And oftentimes we have to use caution when taking these types of supplements because the data is limited, and especially during active chemotherapy, there's oftentimes potential for interaction with those chemotherapy agents. So let's go into a few popularly asked supplements. I'm going to talk first about turmeric. The active ingredient in turmeric is curcumin, and there have been many studies that have shown that it has anti-cancer and anti-inflammatory properties. They do come in capsules, but it's also available as a spice used in cooking. Please note that in using turmeric in your cooking is the safest because there is no known standard dosage right now due to limited scientific evidence on testing with like cancer patients. So it's also important to know that if you do take high doses, there can be some adverse effects. Some adverse effects include increased bleeding. So especially for those who are on antiplatelet or anticoagulant medications like warfarin, it's important to use caution when taking turmeric supplements and capsules. It's okay to use it as a spice in cooking. And there has been evidence to show that taking turmeric supplements may interfere with certain chemotherapy regimens. And lastly, high-dose turmeric supplements can also potentially cause GI upset in the form of GERD, like indigestion. So if you are prone to indigestion, it may be advisable to just stick to using it in your cooking versus taking capsules. The next supplement that I'm commonly asked about is green tea. Green tea can come in obviously the tea form, just as a drink, but it also comes in the form of extracts and capsules. Again, there is limited evidence on the role of taking capsules and extracts while undergoing chemotherapy and other cancer therapies. And this especially is one that can have blood thinning properties. So again, for those who are taking warfarin or any other blood thinning medications, it's important to use caution and talk with your doctor or dietitian about this. It's also important to note that taking too much green tea is in the form of capsules, or even if you are drinking green tea, it can prevent the body's absorption of iron. So it's best to limit drinking green tea if you are needing to take iron supplements within an hour or two around the iron supplements. It's safe to drink up to 8 glasses of green tea a day for most, but note that part of it is because that green tea has high amounts of caffeine. So about 8 glasses will give you about 400 milligrams of caffeine. The normal cup of coffee gives you about 90 milligrams, to give you a reference. So it's helpful to moderate your intake of green tea and limit taking extracts because of the limited data. And Also, just point to note is the reason why green tea has potential benefits is that it is an antioxidant and it has anti-cancer properties. The main polyphenol in green tea is EGCG, and that's why there's a lot of interest around taking green tea, because it helps prevent, it has been found to prevent cancer cell proliferation. All right, moving on here. Ginger. Ginger is has been found to help control treatment-related nausea, and it's generally safe to take. You can have it as a root itself, most often found at your grocery store, and it can be steeped and made as a tea or used in your cooking. There are also ginger chews and candies, which would be safe to have too, and this can help with controlling the nausea as mentioned. One note here, again, as you get seeing the trend here, is that many too high doses of ginger may have a blood thinning effect. So just using it as needed if you're having nausea versus taking any kinds of capsules will be most beneficial and safest. Fish oil is another supplement I'm asked about, and certainly the data has shown that it may protect against cardiovascular diseases and other chronic conditions. There's limited data on its specific effect on GI cancers. And if you do take a capsule, you want to limit it to no more than 3 milligrams combined of EPA and DHA, and only up to 2 milligrams of that should be from a supplement. Therefore, it's better to have it from eating certain types of seafood, such as cold water fatty fish like salmon, mackerel, tuna, herring, and sardines. But other sources of other non-fish sources of omega-3s that you could also use to incorporate would be eating things like flaxseed, chia seed, and walnuts. Plant oils like flaxseed oil, soybean oil, and canola oil are also great sources of omega-3s, as are certain fortified foods. Some brands of eggs will have extra omega-3s, yogurt, juices, milk, and soy beverages. So there are other ways to get it if you really don't like to eat fish. And if you do want to take a supplement, another effect is that it can have blood thinning properties. So again, use caution when you're taking it with any blood thinning medications. And resveratrol is a commonly asked supplement that patients wonder about. It does have anti-tumor and anti-inflammatory effects, but found in lab studies. There haven't been enough human studies to be able to recommend taking this, and especially because it is something that often is found in red wine, and certainly a little bit of red wine can be good for the body, but in excess it is alcoholic, so it can have some inflammatory effects as well if you consume too much. It is something that there is not enough evidence found to ensure the safety in these supplements. So there's also been some information that, or some studies that have shown that there are some hormone effects found, and that can stimulate certain cancer cells. So use caution with this, and obviously it's all best from the diet. So having a glass of red wine, if it's okay with your doctor, is safe to have. And then moving on, so the last 3 vitamins that I wanted to just include here is that about vitamin C, A, and E. And I have a few additional slides on this after, but certainly these vitamins have been found to improve immune function and are plentiful in your diet. So sources of vitamin C, you can get them from many fruits and vegetables like red bell peppers, oranges, kiwi fruits, even green vegetables like broccoli. Vitamin A comes from foods like sweet potato and papaya, for example. And E will come from different types of fishes, for example. And I have additional slides here. This is what I wanted to chat about. So you'll see a list of different types of foods that you can incorporate here. And again, those types of vitamins have been found to help improve immune function. So this is what I wanted to chat about as we are in different times with COVID, and patients are often asking what they can do to help strengthen their immune system. I generally advise patients to avoid taking supplements, but choosing foods in their diet to optimize their immune health. So here's the last two slides that I wanted to mention. And first is making sure that you have enough protein in your diet. So again, those foods that I mentioned earlier, plant-based proteins include legumes, and also nuts and seeds are great. But you can eat some lean animal sources such as chicken and fish and eggs. Also, nut butters are great sources of protein. Vitamin A and C here. So here's a specific list, but as I mentioned, sweet potatoes, carrots, bell peppers, apricots, and other fortified vitamin A foods. Citrus fruits are vitamins, oranges, grapefruits, and tangerines. It's also important here just to note that with grapefruit, you have to talk with your doctor if this is safe to take, because there's lots of foods that have interactions with grapefruit, lots of chemotherapy medications that have interactions with grapefruit. Okay, and then the last couple here, vitamin E, as I mentioned, nuts and seeds, sunflower and safflower oil, hazelnuts, peanut butter, spinach, and then zinc. So lean meats, poultry, and seafood, whole grain products, beans, and nuts. Other nutrients that help improve immune function include vitamin B6, folate, selenium, iron, and prebiotics, as well as probiotics. Probiotics, you know them as yogurt and other fermented products, but prebiotics feed the probiotics. They help kind of give the gas or fuel that they need to function properly. And so those foods include asparagus, bananas, onions, garlic, and leeks, as well as barley. And so that is a quick talk, but hopefully provided some topics of interest for you today. And I'm going to see if there's any questions. Okay, I love fruits, but they have a high sugar content. How much is too much of good things in a day regarding fruits? What a great question to ask. And this is something I normally do talk about, but because we had a shorter session, I wasn't able to include this. So sugars are some things that my patients ask quite a bit about, because they've heard that sugar feeds the cancer and they shouldn't be having any of that in their diet. Now, that's not an entirely true statement. Sugars are plentiful in our diet. They are in fresh fruits, like you just mentioned. They are parts of like whole grains and potatoes and oatmeal, for example. And so choosing foods that are natural and plant-based are very healthful. They provide you with the fiber and the vitamins and minerals your body needs to help stay strong and fight the cancer. Whereas using foods that are high in sugar, like that are more refined, such as having sodas and candies and desserts, don't have any nutritional value. So they don't provide any benefit that actually helps to protect your cells against free radicals that can damage your body's cells and potentially lead to cancer. So there's no restriction on like how much fruits to have, but in general, it's encouraged to have between 3 to 5 servings of fresh fruits and vegetables a day. A serving of fruit, for example, is about a cup size or your fistful size here, like an apple. If you have a really large banana, for example, that may be 1.5 servings. And then for vegetables, a serving of vegetables is a half cup cooked or a full cup raw. So that's something in relation to help you decide, like if you're having like a big entree salad, that may be 2 or 3 servings of vegetables for the day. Okay, so hopefully that helps a little bit. Let's see if there are some other questions. We have a couple minutes left. And would you prioritize prebiotics over probiotic supplements? I actually would not I would put them on the same level because they're both needed to work effectively and improve your immune health. So making sure that when you eat things that have probiotics like yogurt, maybe think about having something within the meal, like having a banana. Sometimes I'll have a bowl of yogurt with some cereal and a banana sliced on top, and that will help kind of give you the best amounts of prebiotics and probiotics to work effectively in your gut. And then also having things like Kefir is another option to have that on the side when you have a dinner meal that maybe has some garlic and onion in it, and having that can be most effective. And let's see, maybe we can choose one more question here. For omega-3, do you recommend cod liver oil? And the answer is yes, absolutely. So that's something you can take. But again, as I mentioned with omega-3s and the fish supplements, or the fish oil supplements, too much can be increased risk for bleeding. So just again, use caution if you are on blood thinning supplements. And then the last question here, what's the difference between pre and probiotics? So probiotics are the bacteria that help, that come from certain food sources, and prebiotics are considered like the food that feed the probiotics. So that's why I was mentioning that those two kind of go hand in hand to be most effective to help improve your gut health and immune function. And I think that is the end of all the questions. Those are really great questions. Thank you so much. And I appreciate you all for attending this session on nutrition.